Hello class, my name is Angela Palacio and this is Multidimensional Treatment Foster Care. Now this assignment was actually very interesting and exciting for me because as a social work student that is planning to go into child welfare or working with adolescents, I found this to be a really exciting and different alternative to typical or traditional foster care programs. Now, in Florida, there are currently over 7,600 children in foster care, and learning about multidimensional treatment foster care helped me realize that there are different alternatives because not all children and not all adolescents are the same or may benefit from the same program. So I would really like to see this implemented in my community in South Florida, which has a very high concentration of children in the system. But I do believe in this program, and I do believe that so far what I've learned is very exciting, and it seems to have very good outcomes. So I really, I hope everyone enjoys it. Okay. So multidimensional treatment foster care is a non-restrictive, community-based intervention for youth aging 12 through 17 that have severe delinquency in their backgrounds and as well in their families. Also, many of these youths have emotional and behavioral issues and disturbances that they are currently dealing with. Instead of having to go to a very restricted and even uncomfortable setting such as jail or a hospital, they are allowed to be sent to a structured environment that can provide care for them. So they don't necessarily have to go to jail. They can still be somewhere controlled and somewhere where they will be supervised without it having to be an actual facility or anything like that. Many of these youths have been removed from their homes due to delinquency, substance abuse, different involvement with the system. Many of them have gone to jail as well, and so they have been removed from the home. And multidimensional treatment foster care is definitely an alternative, and it's typically used once different out-of-home placements have failed, or they're not really meeting the needs or making improvements as they should be. So they do have different home and community settings. So a lot of these are in foster homes with foster parents, but there are also some alternatives. The purpose of multidimensional treatment foster care is really to adjust problem behaviors and teach the youth how to live, how to successfully be part of the community, how to break different cycles, and they utilize other resources to provide parents with support and skills training to also help their teens overcome these different situations. And ultimately, this will strengthen their bonds and lead to reunification with the family, which is always the goal, the ultimate goal of this intervention. So it is cost effective, and it is suitable for all ethnicities and for both males and females. Before I begin the goals of the program, I wanted to mention something about the home and community settings. Now, this program can be used in many residential, outpatient, correctional, home and school, and workplace environments that can vary depending on the need of the area or the community. So it can be used with all different types of people, all types of ethnicities and different communities, regardless if it's an urban area or a suburban or anything like that. So the main goals of this program is to decrease problem behavior and increase a more positive or appropriate behavior in children and adolescents who pose the need for out-of-home care. The program is centered around encouraging youth to also break different cycles of behavior and improve in areas of interpersonal, communication, and academic skills. So not only are they taught how to communicate better, they're also taught how to be more responsible in school and with different activities that they may be offered. The program is geared toward significantly reducing delinquency, which is the reason why they have ended up in this program already, as an alternative to being placed in juvie or being placed in even jail. So it definitely is geared toward reducing delinquency rates among this youth. Also, strengthening family ties and strengthening families within the community is something very important and a very important part of the multidimensional treatment foster care. And of course, the ultimate goal is family reunification, which is the number one goal, and family preservation. So this program is also aimed at preserving families and teaching them how to bond and how to cope in different ways together. Foster parents. The youths are placed with foster parents while being provided with very intense and effective support and therapy. And they are placed in settings, in different foster care settings that resemble normal everyday life with different normal activities and chores. So foster parents, potential foster parents must undergo extensive pre-screening. They must be certified. And the reason for this is because this isn't just a regular type of foster care. It's more intensive and more structured than different foster cares. The foster parents must be willing to work with adolescents who overall may be more difficult and troubled than regular teens, and they have to be significantly involved in their day-to-day activities. So they have to watch them, they have to be very up to date on everything that they're doing. And like I said, the foster parents are pre-screened, and they also perform a pre-service training. And this training consists of different role plays, instructions, and case examples. Also, they receive many phone calls to check on the progress, the day-to-day progress, or any issues they may be having with the teens, and this is done by the caseworker. There is also crisis intervention, which is always available because crisis can happen whenever, and even in these structured programs, so they always have that available to them. Now, the treatment approaches, of course, this program is very therapeutic and educational in nature. They have very close supervision. They have fair and structured limits of what is allowed and what is not allowed. There is a lot of reinforcement and encouragement, but also consequences when there are negative behaviors. There are supportive relationships with mentors and different positive adults that'll be involved in their life. And there's also less exposure to different peers that are having the same types of issues with them. So they're removed from the negative or troubled environment which they're in, and they may be introduced to different peers that have positive relationships or that aren't so troubled as them, so they can get out of that same environment. Okay, a little bit of background about the program. So it was established in Eugene, Oregon in 1960s, 1970s, and this was established in the Oregon Social Learning Center. Later on in 1983, Patricia Chamberlain established a model, which is where all of the programs that use this intervention are based on. Currently, the research is funded by the National Institute of Mental Health, Drug Abuse, and Child and Health Development. Also, they do have funding from the Department of Health and Medicaid programs that are available in that area. Still to this day, this program is very implemented and it's most common in that state. But since then, between 3,000 and 4,000 youth have been able to participate in this program, and it has extended to areas of Canada and Europe, which I think is very wonderful because it's not just something that we use here in the United States. So the model can be used in different countries and different cultures and still have a good effect. So multidimensional treatment foster care is based on Bandura's social learning theory. And Bandura's social learning theory says that behavior is learned from the environment through observational learning. So this means that whether it be positive or negative behaviors that we grow up around or that we're around in our environment, we may pick up some of these behaviors because it's what we have observed. So the way that this intervention works is they try to emphasize and support positive behaviors, and this is done through mentors and through education, and they encourage these youths to try to transition from certain negative behaviors and learn different positive behaviors that will help them once they have left the program. So the theoretical aspect is basically says that daily interactions between family and youth shape both their anti and pro-social behaviors, and these behaviors transition to interactions outside of the home. So the way that we are brought up and the different ways that we interact with our family will directly affect the way that we do that with outside world and the outside society. Negative behaviors may lead to antisocial behaviors that put individuals like these youths at risk for juvenile delinquency, association with delinquent peers, and drug use. And once they are grown up, or once they are no longer young adolescents, a lot of these negative behaviors will lead to incarceration or different turmoil with the law as well. Now, multidimensional treatment foster care is based on a 3-point level system, and the way that this works is the teens have different requirements and different challenges and chores that they are required to complete. So the 3-point level system basically rewards for positive and good behavior, and also implements consequences for negative behaviors or breaking rules or not completing certain tasks that they were required to do. So once they have completed their chores and different things that they're assigned, they will receive more positive rewards. For example, less supervision or games or maybe movies or anything positive that will serve as a reward for them. And the orientation of the entire model and intervention is all about social bonding, it's behavioral, and it's of course focused on social learning. The teens in this program have many risk factors, which in fact have contributed to them being in the program, but they also have different protective factors which are formed and supported within the program. So their risks include aggressive behavior, poor communication skills. Many of these teens have not been able to form close bonds with their family, therefore haven't been able to form different coping skills for dealing with their day-to-day issues. So a lot of these teens are physical and they're very aggressive, which does of course count as a risk factor. Of course, physical aggression and poor family interaction and management. So a lot of these teens and their family have very flawed communication skills. Their protective factors, though, are structured and clear standards within the program. So from when they start the program, there are clear rules and expectations of them, which they are given from the beginning. They are taught different problem-solving skills, different interpersonal skills, skills for social interaction. So a lot of pro-social skills and tools are taught to help these teens to communicate in different ways, maybe find different avenues of communication, whether it be verbally or whether it be writing something down in a journal. So So they're all taught these things that they can take with them once they have left the program. And they are also taught parental social support. So they do involve the parents in attempts to form a more healthy and positive relationship. So once the teens and the parents are reunited, they're able to start from there and be able to form different communication, different types of skills, which will help them once they have left the program. The funding. So this program is cost effective. It is about $200 per day per child. They do have a lot of state and federal funding. They have local funds. They have Medicaid programs. They also have foundation grants, which they don't have to pay back. Sometimes they have public or private partnerships depending on different programs or agencies in the area. And they also have debt financing, which allows them to repay wherever they borrow the money from based on the outcomes or based on the money that they do make off of a certain program. The outcomes for multidimensional treatment foster care can be measured in different ways. Some of these ways are evaluation through different conducted randomized trials. They also perform long-term follow-up sessions, which occur 12 months and 24 months after the youth have finished the program. They also go by different past studies, which of course would be evidence-based, and different research that has already been done through the years. And they also take into consideration self-reporting from the youth themselves. Now, they like to measure the outcomes for boys and for girls separately. For girls, one of the things that is emphasized is the reduction of pregnancy, or to help them reduce chances of becoming pregnant. So this program really focuses on educating these young girls, a lot of them 12, 13, 14, educating these girls on different ways to prevent pregnancy, or maybe giving them education about why it might not be a good idea or why it might not be beneficial for them to engage in different risky behaviors that would maybe have them end up being pregnant. So this is a big issue currently because teen pregnancy is still a big issue everywhere within the adolescent world. And actually, according to the Center for Disease Control and Prevention, in a study done in 2011, it was noted that there are 31.3 births per every 1,000 women, ranging from ages 14 through 17. So this is a pretty big amount, and it's beneficial that this program really gears at educating these young women in hopes of preventing more of these teen pregnancies. So they also have fewer days in locked settings, which means that they have completed many tasks and chores, so they receive less supervision and a little bit more freedom. There are fewer criminal referrals, and like I mentioned before, definitely reduced chances of becoming pregnant. Also, for the boys, there has been noted incarceration rates of 60% lower than where they were before. And also there were fewer arrests, referrals, and runaways. And it was also noted that boys tended to run away or give up on the program more quick than the girls would. For my professional opinion, I asked a social worker, which I already work with, and her name is Connie Price, MSW, and she works at Manor Oaks Nursing and Rehabilitation Center. I resorted to asking her because she's a professional in the field, and she has been for 20 years. And although she works in geriatrics, she also has a lot of knowledge about different interventions and through the years, and she always loved learning about new interventions and new models. So What she found interesting about the program was definitely that it's evidence-based, which gives it a lot of credibility. She also enjoyed that it was based on the social learning model, which Bandura's social learning theory. She thinks it's important that the training that the foster parents have to go through, she likes that it encompasses all aspects of the child and his or her needs and struggles, and also capitalizes on the positive aspect of the child and how they're able to change negative behaviors through the intervention. So overall, she found it to be a very useful intervention, and she found that the different aspects and the different areas which multidimensional treatment foster care tends to focus on really all comes together for the ultimate benefit of the child. So I thought her opinion was very useful, and I really enjoyed talking to her about it. On this slide, you will find a link to a YouTube video about multidimensional treatment foster care. And on the next slides will be my references. I really hope everyone enjoyed everything, and thank you for watching.